What is bipolar disorder? Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional high, mania or hypomania, and low depression. When you become depressed, you may feel sad or hopeless and lose interest in or in pleasure in most activities. When your mood shifts to mania or hypomania, you may feel euphoric, full of energy, or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swing may occur rarely or multiple times a year. While most people will experience some emotional symptom between episodes, some may not experience any. Although bipolar disorder is a lifelong condition, you can manage your mood swing and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with the medication and psychological counseling. What are the symptoms? There are several types of bipolar disorder and related disorder. They may include mania or hypomania and depression. Symptoms can cause unpredictable changes in the mood and behavior, resulting in significant distress and difficulty in life. Bipolar disorder. You have had at least one manic episode that may be preceded or followed by hypomanic or major depressive episode. In some cases, mania may trigger a break from reality. Number 2. Bipolar disorder. You have had at least one major depressive episode and at least one hypomanic episode, but you may have never a manic episode. Number 3. Cyclothymic disorder. You had at least 2 year or 1 year in children and teenager of many periods of hypomania symptom and period of depressive symptom. The last one, other types. These include, for example, bipolar and related disorder induced by certain drugs or alcohol or due to medical conditions such as Cushing disease, multiple sclerosis, or stroke. What is mania and hypomania? Mania and hypomania are two distinct types of episode, but they have the same symptom. Mania is more severe than Mania and hypomania are both two distinct types of episode, but they have the same symptom. Mania is more severe than hypomania and causes more noticeable problem at work, school, and social work activity as well as relationship difficulties. Mania may also trigger a break from early psychosis and require hospitalization. Both mania and hypomania episodes include three or more of these symptoms: abnormally upbeat, jumpy, or wired, increased activity, energy, or agitation, exaggerated sense of well-being and self-confidence, which is known as euphoria, decreased need for sleep, unusual talking, racing thoughts, distractibility, poor decision making, major depressive episodes. A major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in a day-to-day activities such as work, school, social activities, or relationship. An episode includes five or more of these symptoms: depressed mood, marked loss of interest or feeling no pleasure at all, significant weight loss, either insomnia or sleeping too much, either restlessness or slowed behavior, fatigue or loss of energy, feeling of worthlessness, decreased ability to think or concentrate, thinking about planning or attempting suicide. What are the symptoms in children and teens? Symptoms of bipolar disorder can be difficult to identify in children and teens. It is often hard to tell whether these are normal ups and downs, the result of stress or trauma, or sign of mental health problem other than bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic episode, but the pattern can vary from that of adult with bipolar disorder, and mood can rapidly shift during episodes. Some children may have period without mood symptom between episodes. The most prominent sign of bipolar disorder in children and teenagers may include severe mood swings that are different from their usual mood swing. When to see the doctor? Despite the mood extreme, people with bipolar disorder often don't recognize how much their emotional instability disrupts their lives and the lives of their loved one and don't get treatment they had. And if you are like some people with bipolar disorder, you may enjoy the feeling of euphoria and cycle of being more productive. However, this euphoria is followed by an emotional crash that can leave you depressed, worn out, and perhaps in financial, legal, or relationship trouble. when to get emergency. Suicidal thought and behavior are common among with bipolar disorder. If you have thought of hurting yourself, call 911, your local emergency number immediately, and get to the emergency room. What are the causes? The exact cause of bipolar disorder is unknown, but several factors may be involved, such as biological differences. People with bipolar disorder appear to have physical changes in their brain. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Genetic cause. Bipolar disorder is more common in people who have first degree relatives, such as sibling or parent, with the condition. Researchers are trying to find the genes that may be involved in causing a bipolar disorder. What are the risk factors? Factors that may increase the risk of developing bipolar disorder or act as a trigger for the first episode include having a first degree relative such as parent or sibling with bipolar disorder, period of high stress such as death of a loved one or other traumatic events, drug or alcohol. What are the complications? If bipolar disorder left untreated can result in serious problems that can affect every area of your life, such as problems related to drugs and alcohol use, suicide or suicidal attempts, legal or financial problem, damage relationship, poor work or school performance. What are the prevention? There is no way to prevent the bipolar disorder. However, getting treatment at the earliest sign of a mental health disorder can help prevent bipolar disorder or other mental health condition from worsening. If you have been diagnosed with bipolar disorder, some strategies can help prevent minor symptoms from becoming full-blown episode of mania or depression. Pay attention to warning signs. Addressing symptoms early on can prevent the episode from getting worse. Avoid drug and alcohol. Using alcohol or recreational drug can worsen your symptoms and make them more likely to come back. Take your medication exactly as directed. You may be tempted to stop treatment, but don't stopping your medication or reducing your dose to your own may cause withdrawal effect, or your symptom may worsen or return.